Hi everyone, thank you so much for joining us in the Planetary Health Program Building webinar. We're really excited to learn more about various universities' efforts in building planetary health courses, degree programs, and cross-university initiatives in planetary health. And we're really thrilled to get started. My name is Erica Vedas. I serve as the Member Engagement Outreach Manager of the Planetary Health Alliance. And for those of you who are unfamiliar with the Planetary Health Alliance, we're an organization based at Harvard that works to understand and address the human health impacts of global environmental change. We work with over 130 different member institutions around the world comprised of universities, NGOs, research institutes, and government entities working to advance research, education, policy, on-the-ground initiatives in planetary health. The purpose of this webinar is to showcase the tremendous momentum taking place around the world in building planetary health educational initiatives, and to have some of the universities with pre-existing initiatives share with you directly how they went about their efforts, what were their major successes, lessons learned, etc. And we hope that this will provide fodder for the rest of you to think about building similar programs at your home institutions. We are incredibly thankful to our speakers who are spanning the entire globe, who have generously agreed to share their university's efforts in building planetary health programs. And we're also very grateful to Jennifer Gunderman King of the University of New England, Holly Parker of the University of New England, and Amanda McKinney of Doane University for their help in planning this webinar. Jen and Amanda will both also be speaking, and Holly has graciously stepped in to serve as our facilitator. Thank you again for being a part of this today, and we look forward to a productive discussion. And Holly, I'll now hand it over to you. Thank you.
So the first section of today's webinar is really the stakeholder process, and thinking about how we design a stakeholder process in establishing university-wide planetary health efforts. And so our first speaker is Teddie Potter from the School of Nursing at the University of Minnesota, and she will speak about the stakeholder process they use to develop interprofessional curriculum for the entire academic health center. Teddie, the stage is yours.
So greetings, people around the world that are working on this issue. I'm from the University of Minnesota School of Nursing, and I want to do a shout out to my colleague, Shanda Demris. Both of us are available to answer questions after this session. So the University of Minnesota is one of our largest research institutions in the United States. We have over 40,000 students, and we have one of the largest academic health centers. So I'm going to be talking about our initiative to get the academic health center motivated to be involved in climate change work. Now, I realize that doesn't fully embrace planetary health, but it's the first step of moving in that direction. So next slide, please. Thank you. Einstein's definition of insanity is doing the same thing over and over again and expecting different results. So we know that top-down mandated approaches are not necessarily effective in getting a movement, especially cultural change, moving forward. So we decided to flip the system. We decided to start with the students. What do the students want? And we surveyed the students. Shanda developed a survey which we sent out to our health students in our academic health center. We had over 200 students respond, and they overwhelmingly said that this is something they wanted to see in their curriculum, but very few were seeing it anywhere in any of their health courses. So with that data in hand, we were able to go to the leaders and approach the academic deans and say to them, our consumers are wanting this content. So next slide, please. Similar to interprofessional work in healthcare, we know that if we drive it with the patient, voice the patient experience, change happens versus starting with the CEOs of a health system. So we did use the exact same approach here in healthcare. We already have a pre-existing interprofessional practice at the University of Minnesota, which is quite robust. So we started with our assets. Where are we strong, and can we use those assets to bring planetary health climate change work forward? And that's exactly what we did. So we started with something that everybody was familiar with and began to insert climate change into that. We developed a three-phase process. The first phase is orientation. The next one is developing skills. And the third one is applying in practice. Next slide, please. So the first phase was to reach all of our students with basic introductory information about climate change. This was done in a course that all of our health students take in the first year of their programs. It's an interprofessional course, and we traded out some content for climate change content. And we were able to reach last year over 1,100 students, 60 preceptors, 17 programs on 5 campuses. All of those people left with a better understanding of climate change. Next slide, please. Then we started phase 2, which was to develop climate change content that will be inserted into the curriculum of all of our academic schools. So we have medicine, nursing, pharmacy, dentistry, public health, and veterinary medicine schools at the University of Minnesota. We wanted every single health professional to graduate capable of understanding climate change, mitigation efforts, and adaptation efforts, and how to work that into their practice. We developed climate champions from every single school. Those climate champions surveyed the existing curriculum and where was a natural place to insert content and shared content. Then the climate champions worked together to co-create a slide deck that is going to be used across the academic health center. We used the CDC and the American Public Health Association models for the health impact of climate change so that it was all anchored in data. Next slide, please. And here's just a listing of the schools that were involved, the people that were involved, so that you can see that it was a very broad cross-sector collection of champions. Next slide, please. Thank you. Once the content was created, we made sure that it was open access. We want it to be disseminated broadly. So if you get these slides afterwards, you're very welcome to click on the link. It will give you the slide decks, and you can use those slide decks in your own schools, your own universities, or your own professional organizations. It was important for us to have them short, sweet, succinct, because you can get in the weeds with climate data and climate information, and we wanted to make sure everybody had the exact same information going forward. Next slide, please. And finally, the last phase is getting out in practice. So students are doing special projects to green clinics, to be involved in policy changes, to be involved in sustainability efforts in hospitals, clinics, the work that they're doing. And that is just being started, but we're moving ahead on that. Next slide, please. So what's next? The University of Minnesota has a Grand Challenge initiative, and I'm slowly working to see if we can't tie that to Planetary Health. Then it would become a university-wide system, and we are open to talking about this model in other schools so that business schools can move it forward, our agricultural system can move it forward, and we found it to be very effective. And I welcome your questions, and it's wonderful to see all of us connected in this venue. Thank you.
Thank you very much, Teddie. So I'm going to move quickly to my colleague, Jennifer Gunderman from the University of New England, who will describe how we catalyze planetary health engagement at our university. Jen, the floor is yours.
Hello?
Hi, Jen, you're there. We can hear you now.
Okay, thank you. Sorry.
Yeah, no worries.
So thank you, Holly. I am going to now, in the next few minutes, sort of summarize our 1.5-year experience with Planetary Health at the University of New England. So again, my name is Jen Gunderman. I'm actually a public health faculty member at the University of New England. UNE, as we call ourselves, our acronym, is located in Maine. We actually have 2 campuses. We have one in Biddeford that houses our undergraduate arts College of Arts and Sciences, as well as our College of Health Professions, and our medical school. We're the only medical school in Maine. And then on our Portland campus, we have a College of Pharmacy, the College of Dental Medicine, and many of our other graduate health profession colleges, including a physician assistant program, social work, Masters in Public Health, as well as our online programs. So we have 2 campuses. And our tagline, which I will kind of loop back to, is innovation for a healthier planet. Well, back about 1.5 years ago, our Vice President of Strategic Initiatives and Communication learned about Planetary Health Alliance. And through that, sort of sent an open invitation to faculty and staff to attend the PHA conference that at that time was in Boston. And so interested faculty and students attended to see if maybe there's something that we could bring back to the university and maybe take hold and see and explore what were the opportunities. So when those staff, faculty, and students returned back to the University of New England, we quickly decided that the work of Planetary Health very much aligned with our tagline, very well aligned with our vision and mission as a university. So what I'm going to do is just tell you a little bit of some of the things that we've done since then and kind of talk about the key ingredients that sort of led to some of our accomplishments and where there may be some gaps and where we want to move forward. So after returning from that conference, the number of colleagues set up what we dearly knew as the Planetary Health Steering Committee. And we were very fortunate that in that steering committee, we had representation from all 5 of our colleges, as well as from the Sustainability Office and the Student Affairs Office. So already we were very well poised to have an interdisciplinary, intercollaboratory, multidisciplinary approach. Through the work of the steering committee, we then, in last winter, we hosted and coordinated a World Health Cafe project where we had faculty, staff, and students attend, and the purpose of our World Cafe event was to solicit feedback to develop a strategic plan for Planetary Health Alliance and how we could more fully integrate it into the University of New England. With the feedback that we received, we did go on to establish a strategic plan for Planetary Health at the University of New England. The strategic plan included a vision, some objectives and key activities. We also on our campus have an environmental council run by our sustainability office, and so we were able to sort of even share some of the feedback there. That then went on to sort of become even bigger. We knew that at the university we wanted to find alignment specifically in curriculum, research scholarship, and community engagement. And our strategic plan was based around those pillars. During this time, we also went through a significant transition at the university where we actually brought on a new president and leadership, including a provost, and went through a strategic planning process for the whole university. As part of that, we presented the steering committee presented the Planetary Health Alliance to our provost, who was very excited about the work and did see it align very well with the strategic plan that was being developed. He then, recommended that the steering committee develop a charter and bylaws and a more concrete plan and budget, and that he was in full support. So the committee went back and we did just that. We created a charter, we created bylaws, we created a strategic plan and a budget, and have already started to engage in activities. So I just want to sort of moving forward, we are now going to be enacting that strategic plan, and part of that plan is a vision that over the next so many years, fingers crossed, 5 years, that we would actually consider the possibility of having a planetary health center at our university. So I just want to touch on a couple of the key ingredients that have sort of helped us to get this far. The first ingredient was that this initiative, having Planetary Health Alliance a part of our institution, was brought to us by, as I mentioned, one of the vice presidents specifically the Vice President of Strategic Initiatives and Communication. This was a sort of a cornerstone of the success to have leadership actually approach us and say, this is something that I think that would work well at the university, and now I'm going to put in the hands of the faculty, staff, and students to see how it could happen. So we had that leadership buy-in right from the very beginning. Another key ingredient is that we actually have a model at the University of New England for interdisciplinary education. It's primarily focused on the health professions, bringing our medical school, dental school, pharmacy school, and other health professions together to learn and have experiences. That hasn't been much broader than that in a more formal way, but we do have a model. We do have a Center of Interprofessional Education, which includes how do we integrate it into curriculum. There's actually mini grants and funding and professional development. So having that as one of the key ingredients, having that foundation, which as was mentioned in the University of Minnesota presentation. The other sort of key ingredient was that we to have that continuing buy-in from leadership. With the new provost coming on and new president and a strategic plan, we were very much welcomed. We didn't experience any barriers there in trying to explain why UNE should be involved in planetary health. And our steering committee has actually graduated from a steering committee to a council that's recognized and is actually under the provost's office. The other sort of piece that I'll offer as sort of a key ingredient is one of the things that we like to pride ourselves at UNE is having student involvement all along the way. And when we did our World Cafe event, it wasn't just to get input and feedback from faculty and staff, but to have those students involved. And we had done other initiatives that required student feedback in order for a project to move forward. One of the members of our Planetary Health Council is someone who leads our sustainability office, who used the World Cafe model to solicit feedback for the Sustainability Office strategic plan. So we had successfully used these models for gaining feedback. We are now sort of halfway through our academic year. We're now looking to implement a lot of our activities, including doing an inventory of our curriculum, research and scholarship, and community engagement to see what we're already doing and building off of that. Seeing if there's a possibility of having, we're looking at badging at the university. Is there an opportunity to do Planetary Health Alliance badging with some of our curriculum? And then just looking at how can we get a network developed with our faculty, staff, and students so that we can bring like-minded people together to talk about planetary health and to expand the backbone. So I will end here, and I know there'll be time for questions and answers after.
Great. Thank you very much, Jen. And so we're going to ask José Marti, Vice Rector of Innovation at Pompeu Fabra University, to speak about a joint initiative with the university and the Barcelona Institute for Global Health to get a diversity of stakeholders involved in developing planetary health efforts. And we will try and keep the time, folks. I know it's hard for us to do that, but we will be trying to move on to our second section at 4:30. So we'll allow as much time for Q&A, but if you do have questions that you want to put in the chat function, I'm keeping track of those, and we can put those out to the group at the end of José's talk. Thank you. The floor is yours, José.
Thanks, José. As you said, I'm Vice Rector of Innovation of Pompeu Fabra University. I will basically tell you about this project, this new initiative that involves two institutions. On the one hand, we have the Barcelona Institute of Global Health, the IS Global. On the other hand, we have Pompeu Fabra University. So first, I want to start with a clarification. The project for us is identified with the name Planetary Well-Being. That was actually a strategy to try to extend the planetary health. Of course, it builds up on the idea of planetary health, but we want to, push it a little bit forward. So the idea was actually to extend the range of concerns and issues that we find interrelated with the core idea of planetary health. And for us, that was very important actually to get involved many departments of Pompeu Fabra University that are not directly connected with medicine or medical issues. So that's why our initiative is called Planetary Well-Being. The second preliminary point is that this is a very new process, a new project. We started in February this year, 2018. So we are just at the beginning. We are facing the first problems and troubles and so on. And we are basically implementing what we call the first stage of the process. So I will be able to share with you some of the things we are already doing, but basically you have to take into account that this is a very recent project in a very early stage, and there are many things that are still open. So in terms of stakeholders, because we were invited to think about the way in which we have dealt with the stakeholders, what I can tell you is that we basically identified, of course, the plurality of the stakeholders, several of them, but we decided to focus in this first stage on our departments at Pompeu Fabra University, our research institutes and centers, and our researchers. It's not, so we don't ignore that students are very important, and actually they are welcome to join some of the meetings and some of the discussions that we are having. And of course, we are also opening some discussions, some conversations with international partners, with governmental institutions, and other kind of stakeholders. But basically, at this first stage, and for the reason I will specify a little bit more later, we decided to focus on our departments, our research institutes, and our researchers. Basically, to give you an idea of what we were trying to do, we thought that the main challenge we were facing here was basically to transcend the logic of departments and institutes, right? And get all the researchers and all the people involved in those departments and institutes to be able to work in a genuine interdisciplinary way. So in a way, we can say one of the aims of the project is not the only one, but one of the important aims of this initiative for us is actually to use the idea of planetary well-being as a way of transforming internally the institution, Pompeu Fabra University, and making it more open to collaboration with other institutions, and starting with the Barcelona Institute of Global Health. So the initiative is partnered with these two institutions, and one of the first difficulties that we are finding, of course, not surprisingly, is how to share the information, how to make visible what the things that the other institution is doing. So this is basically the work that we're trying to do now in trying to strengthen the connections between the two institutions. Basically, another aim of the project, of the initiative, is of course to commit as a university, and working together with the Barcelona Institute of Global Health, to commit with some kind of global concerns that we all have, and to develop some kind of research that connects with the Sustainable Development Goals. So this, for us, is our way in which we understand that our university can contribute to the development of these SDGs. And finally, in terms of the process that we are running at this moment, what I can tell you is this. So what we decided to do is, precisely because for us the challenge is how to transcend the logic of departments and research units, but at the same time we wanted to be a really transformative process. What we did is we opened up an horizontal participatory process in which we welcome the participation of any researcher at the university, especially identifying, of course, we started identifying those researchers whose research connects more closely with this wide idea of planetary well-being. But we basically invited anyone who might be interested in participating in the project to be part of what we have called the plenary. And this plenary is basically an open, body in which that we have had only one meeting so far, last May. But basically the idea is that we use the plenary to collect all the suggestions, all the ideas, all the proposals that people may want to make. And basically, we address all this information, all these inputs to what we call the task force. And the task force is just a committee or a more reduced body in which key researchers from different areas and disciplines are represented, and also the university, through several central services, is heavily represented. But the idea of this task force is precisely actually to give content to the kind of concrete initiatives that we want to implement in the next year. So to give you, and I will end with that, to give you an idea, a more concrete idea of the kind of initiatives that we are having in mind, and some of them connect with the previous speakers. So we are, we put on the table, and we are getting a concrete shape, a concrete form to several initiatives at the level of research, teaching, and also the institutional level of the organization of the university and the Barcelona Institute of Global Health. At the level of research, we will provide next year seed funding for interdisciplinary groups to try to find more competitive funding in European funding programs, etc. At the level of, and we are also giving economic help for pre-doc and post-doc researchers to present in international conferences or get in touch with international research groups, etc. Then at the level of teaching, we are planning to develop several courses on planetary well-being. One of them will be mandatory for all the undergraduate students at Pompeu Fabra University. We will also open up next year minor in planetary well-being. So all undergraduate students will be able to combine the studies that they are making with this minor in planetary well-being. We are also developing postgraduate, some kind of course offer related to planetary well-being. But what is key, and I will stop with that, what is key for us in all these initiatives at the research level or teaching level or any other, I will be happy to answer your questions later. What is key for us is to promote this kind of interdisciplinary work that transcends the the existing borders between departments and institutes. So again, I put the emphasis here. For us, this project is basically aiming at transforming the university, opening it up to collaborate with the Barcelona Institute of Global Health and make some kind of contribution to these global concerns related to planetary health and planetary well-being. That would be all for now. Thank you.
Thank you very much, Jose. So we are going to extend the Q&A period here to 4:35, so we can accommodate any questions that folks might have. If you want to enter them into the chat function, we can start with one that actually came across specifically for Teddie, but I would love to extend to Jen or to Jose. Really a question about did your institutions use the Sustainable Development Goals, so the UN SDGs, to inform any of your work around planetary health?
So this is Teddie, and I responded in the chat space if people have the ability to see that. And there's a link to our program. We are certainly aware of the Sustainable Developmental Goals. We talk about them, but they are not part of the sort of visual structure or framework.
Got it. Jen or Jose, did the Sustainable Development Goals play any role, or do you envision them playing any role in the work that you're doing currently? Okay, I'm guessing that's a no. Was that Jose?
Yes, no, I just was going to add that so we think that, especially because we twisted the concept to this wider notion of planetary well-being, I think that our understanding of planetary well-being matches perfectly well with most of these SDGs. So I think that, many universities in the world are basically trying to develop new programs and new initiatives related to SDGs. Mm-hmm. But I think, so what we're trying to do is to make this distinctive approach, with distinctive contribution on the basis of this idea of planetary well-being.
Yeah.
And this is Jen. Oh, sorry, I was answering before, but I guess it didn't come through. At University of New England, we have not used the MDGs or Sustainable Development Goals as a foundation. I think there's definitely potential. One of the things I forgot to mention, at UNE, we actually have a campus in Morocco, so we definitely have a sort of global pull, so I can definitely see it being used in the future.
And I would actually add to what Jen said. We have some groups within the university that are very explicit about the Sustainable Development Goals. So actually one of the institutes that I'm involved with, I'm an associate director for the Institute for North Atlantic Studies. The Sustainable Development Goals are foundational for us, so we feel that may move out through the university as we continue our work in the institute here. So I'm going to pose one more question to the three speakers before we move on. And this is a kind of a how-to question, but how did you assess your university or institutional landscape and its culture, and how did this inform your decision-making process of whether to pursue planetary health and building stakeholder groups?
Well, this is Teddie, and I think because we have a history of working across the disciplines and working in collaboration on key strategic issues, it didn't even cross our minds that we wouldn't work with one another. This was just the way we did it. What we hadn't brought in before, though, was the student voice and a future-looking plan as far as we need to be addressing educational needs of our practitioners of the future, not what we need just right now, but what our assets and capabilities are our future providers going to need, and that's what drove us.
That's fantastic. Thank you.
Well, at the University of New England, we did not do a formal assessment process. However, when the steering committee was able to easily get representation from all the colleges and plus some of the key offices that I had mentioned, I think that was sort of a quick and dirty assessment that there was definitely interest. Then the second part of that is we did our World Cafe event around strategic planning, and we had just a lot of support from student, faculty, and staff across the university. That for us was another key indicator that there was interest, not only just to kind of show up, but also to do something.
Excellent. So before, I just want to make a note that Sandeep, I do see your question in the chat box. I think it's actually one that will perhaps be answered by the speakers in our next section. And if not, I think they'd be very well positioned to answer it. So I have grabbed that question. So stay tuned. Let's move on to section 2 of our webinar today, in which we're going to talk about developing planetary health degree programs and courses, which seems to be a goal of several of the speakers in our first section. But it seems like folks are already doing the work. So first up is Professor Mary Richards from Brunel University in London, where she's the program director of a Bachelor of Arts in Science and Global Challenges, and Dr. Alwyn Martin, who is curating the planetary health strand of that degree. So I hand it over to Mary and Alwyn.
Thank you very much indeed. I just one slight correction there. I'm actually a reader rather than a professor. That sort of got lost somewhere along the lines anyway. So I was just going to do a brief kind of overview of why we came to be building this new program in Global Challenges. And again, it really evolved out of a former role I had as the Vice Dean of Education within my college, where we were looking to, consider what was the role of higher education in the 21st century and what would a graduate coming through that system look like. So it was really much aligned to thinking about the necessity of in the marketplace, the graduates who had a range of different skills and could move between different disciplinary lenses more effectively. And then the more we kind of examined this particular sort of field, it became apparent that the one key thing, the one sort of cohesive part of this was this concern with climate change, and of course climate change impacting on health. So the program itself, can we just go to the next slide for a minute? Actually, the next one after that, because I think that's too granular, was to have a core spine which we developed through a long drawn-out process of navigating across the whole institution to then come up with 4 pathways, all linking to this overarching theme of global challenge. So that's just a sort of, I suppose, very, very brief overview, which we can go into greater detail and discuss things about how we go into stakeholder engagement and what we actually decided to put in the program and how we kind of actually made it happen, because it's taken 3 years to get to where we are now, which is with our first cohort. So I'm just now going to hand over to Alwyn Martin, who's going to tell you more specifically about the development of the planetary health strand pathway.
Good morning or evening, everyone. So I'm Alwyn Martin from Brunel University, and I'm curating one of the pathways of this Bachelor of Arts in Science and Global Challenges, which is concerned with planetary health. And in order to answer some of the questions that were put to us, it does build on existing programs and future program, namely an environmental science BSc or Bachelor of Science. And from next year, there will also be a BSc in global health. And our students take some of the, we have a system which works in blocks, study blocks and assessment blocks. So they take some study blocks with environmental science student, and at the moment they get global health on their own, but from next year they'll be with global health students. And they get also some time that is specific for this pathway that is trying to help them make the connection between these ecosystem transformations and health impacts, focusing particularly in using system thinking to be to do this, but also using some of the cross-cutting principles that were enunciated by this brainstorm on planetary health education group. And I suppose it's organized over 3 years, where really the first year is setting the foundations in getting some disciplinary knowledge in environmental sciences, earth system sciences, ecology, etc., and also public health. They are covering some of the socio-economic and cultural context aspects, both through the core spine and also as social determinant of health. And in terms of how we address transdisciplinarity or interdisciplinarity, is through the fact that they interact with students on different programs and also interact with students that are on different pathways as part of the BASC global challenges. And I think how we conceptualize and communicate the value of studying planetary health to students is mostly through case studies, where we demonstrate sort of the failure of reductionist linear approaches and try to demonstrate the value of system thinking. That'd be it for me. Thank you.
All right, thank you very much, Mary and Owen. We're going to move now to Canada, where Ashley Amon is a research fellow who will be speaking about the development of a hybrid transnational multi-site course offered through the Schools of Public Health at the University of Toronto and Moi University in Western Kenya. Ashley, the floor is yours.
Thanks, Holly, and thanks everyone for joining us today. So at the University of Toronto, I had some slides. Are they available? Thanks. So at the University of Toronto, planetary health education initially took the form of a standalone course offered in the School of Public Health as a short course, which means it's a quarter credit and 6 weeks in duration. And that was piloted in 2016. The curriculum development process at our institution involves gathering information on other courses with similarly themed content and learning objectives to ensure that we're complementing them. And this process revealed many other efforts linking environment and health, both within the school and the institution as a whole. So not only did we know that we weren't starting from scratch, but we're also encouraged by the potential to expand and coalesce a community around planetary health. So over the second and third year this course was run, it was developed into a multi-site hybrid course offered in parallel at the Schools of Public Health in Toronto and Moi University in Western Kenya. And then the short course was expanded to a 12-week full credit course, where the weekly classes were divided between within-site learning time and then interactive participation across sites through video conferencing. Now, although the course has now grown into this standalone full semester curriculum, there have been actually quite enthusiastic discussions at both institutions about how we can integrate it into other programs and curricula within and outside of the schools. Now, the current facilitators, in addition to myself, include Dr. Paula Breitstein and Dr. Susan Kano, and they're both actually based in Kenya, and they've been really instrumental in building the momentum and relationships within and between institutions that have helped planetary health to thrive and grow as a concept and a discipline. Next slide. So considering its origins and developers, the rationale and goal for the course were very much shaped by public and population health perspectives, basically recognizing that the scale and scope of the problems we are facing are profound, and public health specialists need to be at the forefront of driving change and sustainability. So offering a course like this has not just been about learning and exchanging information, but also about providing a relatively rapid, rich, and comprehensive way of getting our heads around the issue, and giving us direction and ideas for how and where we can intervene for public health improvement. In this regard, having this cross-site interaction between students has been really fruitful. For example, I've shown an introductory slide like this one as a fun way of breaking the ice, but it has also served to highlight how our perspectives and biases are shaped by where we come from, and then frame planetary health education as a platform for conceptualizing and disseminating this awareness. Next slide. Finally, I just wanted to touch briefly on this question about addressing interdisciplinarity by showing you the homepage of our course website. And this has been a very helpful hub of sorts, where students and facilitators can connect and communicate and share resources, a complementary way of extending the learning that happens in the classroom and building community around a topic that is relevant not only across disciplines, but across ages, genders, and cultural worldviews. Thank you.
Thank you so much for that, Ashley. And so the last speaker in this section is Jen Meredith of Cornell University, who will speak to Cornell's integration of planetary health into a Master's of Public Health program. Jen, the floor is yours.
Thank you. And so I have some slides. Great. So I'm going to talk about what we are doing here at Cornell, where we see the pillars of sustainability, equity, and engagement as the future of public health. Next slide, please. So we started our Master of Public Health program a year and a half ago, but we started planning for it a year and a half before that. And that aligned really nicely with the launch of the Lancet Commission on Planetary Health. Next slide, please. So what you can see here is what framed our initial launch. We talked about, or we came to recognize that the Earth has been around for a really, really long time. And we, in fact, humans as we know it, have only been here for about 1/400th of that time. Next slide, please. Sorry. And so in that time, we as humans have identified and used nature's resources to achieve great things. Next slide, please. Like how to conquer space and get to the moon, how to access and manipulate materials, to build structures that defy science, to identify and stop pathogens, to prevent or mitigate making others sick, to cure what were once deadly ailments, and to feed the world. Next slide, please. But we've also had a significant impact on the Earth. Loss of species that provide important services for us, changes in climate that affect the way that we can use land, emergence or reemergence of diseases, and emissions of particulate matter that settle into the Earth and into our lungs. Next slide, please. And so in short, we couldn't think about teaching public health without taking a planetary health approach. Next slide, please. So how we combined this in our curriculum. Next slide, please. We started out with these 4 explicit actions. First is we scanned the university to see who was here and who could help teach focal areas related to public health and planetary health. And we identified 70 affiliate faculty from 11 different colleges and schools here at the university. We then complemented that with a few good hires, 2 of which brought explicit expertise in planetary health. The third thing that we did was build some new courses, and we built 13 new courses to complement what Cornell already offered, and we built planetary health into 4 of those. And then we developed a series of applied practice courses so we could help students take and translate their knowledge from campus into the communities. Next slide, please. And so the approach that we took was this. There's 3 overarching outcomes that we need to have students walk away with is human health can still be improved. Things are great in some ways, but there are many disparities. That will not persist, or the health that we have achieved will not persist if we can't find ways to better sustain our ecosystem resources. And third, we have the power to help lead this change. Next slide, please. So we started, as we bring students into the class, we start by defining planetary health. And basically, we talk about the One Health triad and how these interactions impact human health, and how changes in human health drive key demographic, economic, and sociocultural factors that in turn have an impact on environmental, animal, and human health. To reinforce this learning, students do a major term paper in their first semester focusing on these dynamics and possible levers of change. Next slide, please. We then take this to the next level by challenging students to think through the multiple factors that influence individual and community health. In this example, you can see planetary health factors layered into the biosocioecological model of health. To reinforce this learning, students do a major term paper in their second semester focusing on these dynamics and again, different but same possible levers of change. Next slide, please. Students next move into their application phase where they plan and apply a public health approach to a community-identified public health need. We have set out with the idea that planetary health will be a prominent component of each of these community-based projects, but we recognize that we're not there yet. And next slide, please. Last but not least, in line with the idea that we have the power to lead change, we explicitly teach principles of collective leadership and help students work with communities to identify their most pressing needs and to plan for collaborative ownership, planning, and implementation. And again, thus far, only 1 year into our program, we're finding that issues of planetary health are not always prominent with the communities that we're engaging with, but we're learning that and we're exploring ways to better, quote unquote, message planetary health to see if we can help make this more prominent or bring it to the surface in these collaborations, as we truly recognize that planetary health is at the basis of or the foundation for all public health now and into the future. Thanks.
Thank you very much, Jen. So we have about 10 minutes to do some Q&A around developing planetary health degree programs and courses. So if folks want to send us some questions via the chat function, that would be great. I do have a couple lined up here. First, actually, this is a question from Sandeep that I think will suit this group quite well, which is, as you were pursuing kind of building out these courses and programs, how did you fill in the human resources gaps that may have come up? I know that there was some hiring involved. As we moved into more transdisciplinary teaching spaces, how did your institutions address that?
This is Jen from Cornell. Yeah, so as I mentioned, we had a little bit of luxury in that we were starting a new program, and we recognized that we were going to have to do a few more hires. And so we first scanned the university to see where we did have resources, both content, but also people who were willing to share their courses or share their expertise in our new program. And once we did that scan of existing resources, we fairly judiciously figured out where we needed to hire people to fill gaps, and then also identified where we could bring in short-term guest lecturers to help fill in content that we don't have here.
Hello?
Hello, Mary, yes.
Oh, yes, no, the situation was somewhat different at Brunel, where we were working across the institution, so working a lot with getting some buy-in from senior management, including the deans, to allow staff who were interested in the program to participate. So it was a case of not being given the resources initially. We kind of had to prove ourselves before we were actually now in a position to start potentially recruiting people specifically for the program. So essentially we were relying on people's interest and enthusiasm in getting involved in the program and wanting to do that, to then go to the deans and negotiate a small amount of their time to contribute to the program. So it has been quite a complex process, shall we say. I don't know if Olwen wants to say from her perspective how it's worked.
I think it may link with some of the question that I see coming up, because it has to work across colleges, what we have our colleges, and that is a challenge. But because this is a global challenge program, I think it's important that it did that. But most of the planetary health material is actually delivered by people that are in it's our College of Health and Life Sciences, whereas the course line within the Business and Social Sciences college.
Yeah.
So, yeah. And I was just reading this question about ownership. So, and again, that was a huge dilemma, and quite a case had to be made because we were kind of breaking all the rules in terms of where this program actually sat and who had ownership over it. So that has been an institutional challenge, And again, when it comes down to it, it's a bit sort of bean county in terms of, how much time and money comes from individual staff members who've become part of the team, and how that plays out both within the core part of the program and then within the pathway strand of planetary health and the other three pathways as well. So that was something that took quite a lot of time and negotiation to work out.
Yeah, so the question that Mary is referring to in the chat is have the speakers found it better to keep ownership of planetary health programs within one school or faculty, or for them to be jointly owned? And have they found that particular models work better than others in terms of driving interdisciplinarity? And I think that is a key design challenge that many of us are facing as we try to bring planetary health into our institutions. And I didn't know if Ashley or Jen, you had any response to that question as well.
Sorry, I think I muted myself. Yeah, I don't have a lot to add to either of those questions, because right now we're one course within a School of Public Health, and it has remained within the School of Public Health for its first 3 years. But I can say that as the course started, Paula Breitstein kind of championed the development of this course, and for the first year running was the only instructor. But she brought in guest lecturers for several of the sections, to bring in expertise from various areas. And so I think that has now started to was good exposure for the course, and has gotten a little bit more buy-in from other departments. And I think so now that's kind of where we're headed, as we're trying to evolve and develop and expand the course further, to now start to cut across departments and then look at potential for other faculty to be sort of more or less semi-permanently involved in the course, as it maybe develops even into a program like some other speakers have described. So that's kind of like the situation where we're at right now.
Mm-hmm. All right. Oh, sorry. I don't want to cut anybody off.
I was going to say that this is Jen, and it's a really good question. I've been sort of going through the cobwebs of my brain thinking about how we have it structured here. And we do have our academic program residing within one school, although we draw heavily on partnerships from across campus. And that is by nature, because of sort of the bean counting that Mary mentioned before, that's just the way things work at Cornell. And yet we have found really great success in using collaborative units that sit outside of any explicit department. And one example is the Atkinson Center for a Sustainable Future. And they're a unit on campus that recruits different faculty fellows in to invest in collaborative research projects to really help drive change and impact. And so they're a unit where many people have been able to come together under shared ideas related to to planetary health, and begin to find ways to work together outside of the perhaps confines that come with a degree program.
So one more question. This may be opening kind of an interesting can of worms, but we've gotten this question in a couple of different forms. But have any of you worked explicitly with integration between health schools or programs and programs such as agriculture, environmental colleges, law and policy schools, to get multiple expertise and perspectives as you design your programs? And if not, what would you think of that model? Kind of what would be your approach to that model?
That is certainly the model that we were going through in developing a transdisciplinary degree, was the idea that we were tapping into the resources from across the institution. So we didn't want those things to be isolated, that environmental science wasn't linked up with public health, that also wasn't thinking about how it might impact upon society, politics and law. So, and that's where the core part of the spine plays a really important function in bringing together people on the different pathways. But also that is also working on practical projects with somebody who can integrate the various aspects of the subject matter in ways that put it into very practical applications, which is why we've got the partnership with the UNDP.
this is Jen. I'll echo all that Mary just said. We too tried to really explicitly pull people in from various backgrounds, including agriculture, including veterinary medicine, including human medicine, including climate science, including law, including business. And so I feel like we've done a fairly nice job, again, similar to what Mary described, of building this core curriculum that is multidisciplinary. And I think public health lends itself really nicely to that, because public health is, in general, a very multidisciplinary profession. We also, I think, in developing a new public health program, that also potentially gave us a little bit of leeway to bring in people with different expertise to our program. So we recognized that we had really strong expertise in some areas, but if we wanted to be teaching public health from a planetary health perspective, we needed expertise in areas that weren't yet here, and that's what drove our recruitment initiatives.
And what we've quite recently found is, it has been quite interesting from the Brunel perspective, is that we also have, aside from the colleges, we have 3 institutes, research institutes, and talking to colleagues in one of those institutes who's closely aligned with this program, has found that the research fellows that are now applying for some of the programs in their department are actually specifically asking whether they can teach on this program because of its transdisciplinary nature and the way in which they see it links with their research interests and aims. So we're very much hoping that as time goes on and the profile of the program increases, that we will be attracting further staff to put forward their own ideas about how they might contribute and grow the program.
That's excellent. Thank you all. And I wanted to read out one comment that was in the chat box from Teddie Potter to this thread that you all are discussing. And she writes, one of the barriers at large universities is who will benefit from tuition dollars. We've had to find early adopters willing to flex time and perhaps less pay than if we were teaching in our own discipline. The payoff is in the magic that happens when students see faculty from different disciplines share knowledge and have difficult yet healthy conversations. I teach with a soil microbiologist, a fish and wildlife conservation biologist, and I'm a nurse. Students see the partnership of disciplines rather than the ranking of disciplines. And I think that's a true opportunity of planetary health in action at universities.
Absolutely.
So we are on time, which is kind of excellent. So I'm quite pleased. So our last section is part 3, building a university-wide planetary health program. So we have gone from stakeholder engagement to degree programs and courses to now a university-wide planetary health program. Our first speaker is Tony Capon from the University of Sydney, who will speak to how they developed the planetary health platform. So Tony, the floor is yours.
Great. Oh, thanks very much. It's an absolute pleasure to be with you today. I've really enjoyed listening to all of the great things happening in other universities. And in my 3 minutes, I'd just like to give you a sense of how we came to establish the Planetary Health Platform. And one part of that was my appointment as Professor of Planetary Health within the School of Public Health at the University of Sydney. And that happened about 2 years ago. The school advertised a chair in environmental health, and they were really, I guess, initially seeking somebody with particular interests in air pollution, epidemiology, and health, perhaps some focus on climate change and health. And when I applied, I did a pitch around the opportunity of this new way of thinking that we were calling planetary health. I'd been part of the Planetary Health Commission process. And they came back to me and said they liked that, and subsequently said, would I like to have the chair changed in title from environmental health to planetary health? And I agreed to that and was appointed in that role, expecting initially that we would just develop new education and research initiatives within the School of Public Health. But once I was on board, what I found is that the university vice chancellor here, the equivalent of a university president in North America, had made a very substantial commitment to multidisciplinary research and education at the university for about a 10-year period. And that meant that they already had a suite of cross-disciplinary centers and institutes and a culture in the university that was embracing bridging disciplines in both research and education. And as we had conversations, it became clear that there was an opportunity for a new initiative at the university level. Our colleagues, particularly in life and environmental scientists, were looking to establish a new initiative around the Anthropocene and its various challenges. And I might just focus on the slide that I've sent through to explain how we thought through this together, using, I guess, the lens of human ecology and understanding that if we are to be transformative here, we really need a new conceptual framework for the total system, essentially how the world works, if you like. And this framework in that slide, which I realize is a little bit difficult to see, but I'll walk you through the key points, comes from the eminent human ecologist Stephen Boyden. And essentially, the essence of this is that human culture is now a force in nature. And so on the left-hand side of the schema, you can see the cultural system, the cultural options in that system. And in the first box there, human culture, our worldview, what we believe, what we know about. And that mindset, if you like, influences the way we organize ourselves in society. Box 2 there. Societal arrangements, our economic system, for example, that we choose, the regulations that we put in place. And then to the right there in the middle, those cultural options influence a range of biophysical options. Box 3, the human population itself, the numbers of people, the way they group together, the densities. Box 4, the human activities that we're doing collectively, for example, the fuel we're using, what we're manufacturing, how we're farming, for example. And then in box 5, the human activities that we're doing as individuals, our lifestyles, if you like, livelihoods, and the way we move. And then box 6, importantly, the artifacts of civilization, the things we make, what we build. Are we making roads? Are we building mass transit systems? What sort of approach do we have in the things we make? And then on the right, all of this human system that we've discussed thus far is nested within the biophysical environment of the rest of the biosphere, if you like, with its physical elements, the atmosphere, ocean, clay, and rocks, and the living elements, the plants, all the other animals, the microorganisms. And the bottom line of this understanding is that the health of humans, of all other animals, and indeed natural systems